As you heard, my name is Chelsea Marcus. I'm a first-year public health student, and I've been working with CT Voices for a practicum for this semester. So today I'm going to be talking a little bit about the Affordable Care Act, Repeal and Replace. And I'll specifically be talking about what the American Health Care Act is, and Sharon's going to be talking about who will be impacted by the American Health Care Act, as well as the threats to the state of Connecticut, both national and state level. So in order to understand a bit more about the American Health Care Act, we have to sort of understand the building blocks of the Affordable Care Act. And the first one, I would say, is insurers cannot deny coverage to those who have pre-existing conditions. This is just something that we want in our healthcare system, that we're not denying coverage to those who need it the most. The second, the individual mandate to make sure that people don't wait to get insurance until they're sick. That drives up healthcare costs, just because those individuals will need those health services at that point in time. And the third is help for low-income families to afford insurance and to comply with the individual mandate. There are two parts to that. The premium subsidies in the AHCA exchanges, those are the federally facilitated and state-based exchanges that were created under the Affordable Care Act. So those generally helped people to purchase insurance and to pay for co-pays in the exchange's health plans. And that helped individuals from 138 to 400% of the federal poverty line. Those were income-based. And then the Medicaid expansion also helped low-income residents to afford or to be able to be covered under Medicaid. So the American Health Care Act, we've all heard a little bit about it, but that is the official Republican proposal to repeal and replace the Affordable Care Act. Some of the main features are changes to the premium subsidies. Instead of being income-based, they will now be age-based, and we'll see a bit later on that will lead to significant cuts to subsidies. So there are also changes to Medicaid that will cause cuts in funding. Unfortunately, they're changing the structure of Medicaid, and that will make it so that states get less federal funding to cover those under Medicaid. So the American Health Care Act also replaces the individual mandate with premium penalties. So that's meant to encourage continuous coverage. So they don't want gaps in coverage, so they are penalizing people when they purchase insurance. It also allows for age variation in premium rates. So generally, insurance companies will charge older enrollees more than younger enrollees. And under the Affordable Care Act, that ratio was 3-to-1. So they could charge older enrollees up to 3 times as much as younger enrollees. But under the American Health Care Act, insurance companies will be able to charge older enrollees up to 5 times as much as younger enrollees. It also, in effect, defunds Planned Parenthood. It essentially has a 1-year ban on federal funding to Planned Parenthood, which will make them less able to deliver on their family and reproductive health services. So it's important to note what was not repealed in the American Health Care Act. So what has not been repealed, the ban on pre-existing conditions, which I mentioned earlier, the ban on annual and lifetime benefits caps. So insurance companies are still not allowed to put a dollar limit on the benefits that you can receive over the course of a year or the course of a lifetime. The ban on health coverage underwriting. So insurance companies are still unable to, on the basis of you having a pre-existing condition, they can't jack up your rates based on that. The ban on discrimination on the basis of race, nationality, disability, or gender. Something notable with that, insurance companies are still not able to charge women higher costs than men due to the fact that they have traditionally higher healthcare costs. And dependent coverage up to age 26, that has not been repealed, which is not surprising. That was one of the more popular provisions in the Affordable Care Act, as well as Medicaid coverage up to age 26 for youth formerly in foster care. That has also not been repealed. To get a bit more into the exchanges and tax credits, the structure of the exchanges remains the same, but as I mentioned before, from 2020 onwards, instead of having income-based tax credits, they will now be age-adjusted. And on the right, you can see the breakdown of the age-adjusted tax credits. So in general, this means that everyone who's making up to $75,000 a year, they will get the same tax credit as someone the same age as them, regardless of their income or the cost of healthcare in that area. So in terms of insurance options, as I mentioned, the individual mandate is replaced by an insurance penalty. And to get a bit more detailed, if you go without coverage for 63 days, insurance companies are able to charge you a 30% premium on, or they can jack up your rates by 30% on your premiums for a year. So this is unfortunate because it discourages buying insurance when you need it, just because you've had gaps of coverage. In addition, the actuarial value and metal tier requirements have been repealed. Those were requirements that were created under the Affordable Care Act that were limits on how costs are split between the insurance company and the individual. So the minimum requirement for the cost being split was the bronze, and that was cost split 60 to 40, 60% on the insurance company, 40% on the individual. The silver tier was where the subsidies would kick in. You can also see the breakdown for gold and platinum. So the real problem with this is that it's hard to compare insurance plans now because this has been repealed and this structure is no longer existing. And one last thing to note with insurance options is that the American Health Care Act, it encourages high deductible health plans. They've increased the tax benefits for health savings accounts, and unfortunately, the only people who are able to afford high deductible health plans are generally middle to high income individuals, and so that sort of cuts out the low income to middle or moderate income individuals who might need coverage a bit more. So we're going to go into Medicaid restructuring.
Do you want to see if anyone has any questions so far?
Yeah.
Does anyone have any questions or comments? You know, recognizing that we put these slides together a few days ago, and if you've been listening to the news or reading or you're on Twitter, that some of what you just heard, you know, could be different, could be worse. For instance, there's proposals by the most conservative members of the House of Representatives to get rid of providing essential health benefits. That includes maternity care, substance abuse treatment, children, coverage for children, hospitalization, emergency room, whatever, drugs. So this just gives you a flavor, to tell you the truth, of what could happen if Congress ultimately would pass a version of this bill and then the president would sign it. But I open it up in case anyone has questions or comments that they want to make at this point. Yes, just wait for the mic.
I just wanted to clarify the penalty, premium penalty. So instead of getting, or not the premium penalty, the tax credit. That will not be an advanced premium tax credit like it is now. It would be when the person files their tax return, they would then get a tax credit. Is that how it would work?
To my knowledge, yes.
Yeah.
Yeah, they are, yeah. Yeah, it's not clear. What Pat Baker was just saying is they are talking about advancing it. The problem, even if they advance it, it may work for some people. That may be enough to cover their insurance premiums, but particularly as you get older, it's truly not enough. The other thing that I heard was that in their original proposal, if you had somebody, this isn't the most likely scenario, but if you had someone who the premium, the tax credit rather, is more than what the person would have paid for the insurance, under the original proposal, they could keep the difference, a little bit more money in their pocket. The most conservative people in Congress were worried that people would use it for abortions, so that they didn't want it to be that essentially you would not be able to keep it. It would be deducted out if it was more than what your insurance costs. Given how expensive insurance is, that's not the most likely thing to happen. Does that?
Thank you.
Yeah, great. Sid, and I'll let you. Okay, so again, taking some of this with a grain of salt because it isn't exactly clear what Congress would do. The most important thing is that essentially would end the Medicaid expansion. So in Connecticut, as you know, that's the Husky D group. Right now, Connecticut gets about 95 cents on the dollar to cover those people, which is really, really important given our budget deficit crisis. And they would actually get rid of the additional funding even earlier than what's in the original proposal, ending it in 2017. And if the ACA weren't repealed, then the way it would work for the expansion group is that it would be reduced, but only to 90%. So the federal government would reimburse Connecticut 90 cents on the dollar for the 217,000 or so low-income adults that are now covered on Husky D, and that's at risk. It would reduce the mandatory income limit for children on Medicaid to 100%. Connecticut has always chosen to cover kids optionally above whatever the mandatory limit is, but some of us are really worried that even if the governor, even if our legislature were not inclined to do that, that given the state budgetary pressures, that it's not inconceivable that they could roll back Medicaid eligibility for children. And then, essentially it does away with the entitlement to Medicaid, meaning that the way it works now, as I think most of you know, is if people are eligible, they have income under a certain amount, they're either a U.S. citizen or a legal immigrant or live in Connecticut, that they're eligible if they meet those general requirements, and that would end under these various proposals within the American Health Care Act. The original proposal is what's called a per capita cap, meaning they would give the state a certain amount of money for a child, a certain amount of money for a disabled person, a certain amount of money for a senior, and that amount of money would not grow if healthcare costs grew. And we know healthcare costs grow, that you have expensive medications like the medication for hepatitis C. You have public health crises like Zika that require a lot of health services for newborns or other people who are afflicted. And then just to make it even more onerous on states, they also have, in a later proposal, also given states the option of just taking a lump sum amount of money for a 10-year period. It's called a block grant. And again, that money really wouldn't grow enough to keep covering all of the people that we currently cover under Medicaid. It also does something really, really bad for children, which is it gets rid of the guarantee for comprehensive health care, and really would have a very bad effect, particularly on children with special health care needs. In Medicaid lingo, that's called EPSDT, which stands for Early Periodic Screening Diagnostic Treatment Services. Okay, so I've said some of this already, but what does this all mean in a little bit plainer language? In regard to the insurance, it would become more expensive, and there would be potential loss of coverage for many because, as you know, particularly the people that you serve would not have the financial resources to purchase coverage. It would move again to high deductible plans with higher out-of-pocket costs. And then, as we just discussed with Medicaid or a AHCA program, it would really force states to likely reduce the program in various ways, including reducing coverage. With the original version of the AHCA, the budget office for Congress, it's like the Office of Fiscal Analysis at the state legislature or the Office of Policy and Management for the Malloy administration. It's predicted that by 2026, there would be 24 million more people uninsured than would have been uninsured if we just kept the ACA. 14 million would become uninsured, I believe, in 2018, 20 million by 2020. And again, these are estimates. This, I think, is one of the most important takeaways, which is just saying it more simply than what I just said, which is that more people will become uninsured if Congress did nothing. If they just repealed the ACA, not nothing, but if they just repealed the ACA without a replacement, and that's because they are capping, changing the way that Medicaid is structured. They're taking away the entitlement. They are either proposing this per enrollee cap on federal funding or block granting funding or doing some combination of both. So if they just repealed the ACA, we would have fewer uninsured people than we will under what's being debated in Congress right now. And then to make us all feel even worse, who will be impacted the most? Not surprising, children, and as I said earlier, children with disabilities, older adults, the adults who aren't quite eligible, aren't quite old enough to be eligible for Medicare, middle and lower income families because they will have to pay more out of pocket, people with substance use disorders, there won't be coverage either because the people won't be eligible for Medicaid, or if they roll back the essential health benefits, they won't be covered, or they just can't afford to pay for substance use disorder treatment. Rural communities, which really benefit from Medicaid, for instance, because they tend to be lower income populations, will be adversely impacted. And needless to say, women needing reproductive health services, partly because of essentially defunding Planned Parenthood, which I think many of you may know that of the 60,000, not just women, but women and men that use Planned Parenthood services in Connecticut, about 30,000 of them are covered through Medicaid. So it's a really big threat if if they no longer have access to Medicaid. Again, so just explaining a little bit more about what could happen in Connecticut, notwithstanding the fact that both the Malloy administration and the legislature really don't want to roll back coverage and health care for people in our state. But the people who are most threatened, again, those older adults, people with disabilities, children, low-income parents, low-income adults. And then, so what would a state like Connecticut have to do with far less money in Medicaid? They can, fill the gap, but as we know, we have a $3 billion or more deficit over the course of the next 2 state fiscal years, so that's not likely to happen. They could reduce benefits. We've worked hard in this state, you've worked hard to provide or to maintain and improve dental coverage for children and adults in the Medicaid program. We could decide to jettison that, reduce the number of people served, and reduce payments to providers. If there are providers in this room, I don't think they'd be too happy about that. And then in terms of what would happen to the health plans offered through Access Health CT, the estimate provided by the Malloy administration is that the average person will receive over $2,000 less in subsidies or assistance in purchasing coverage on that exchange. And again, health coverage will be less attractive to people who need it. The Office of Policy and Management projected that 34,000 individuals would not likely renew their coverage in 2018, that there would see insurance increases for all consumers. And then without that individual mandate, which is, it's like being a parent and nudging your kids, it would mean that fewer individuals are likely to enroll because there's no longer a penalty for not enrolling. People will wait until they're sick, and this was the problem before the ACA, when if people wait till they're sick to purchase coverage, what it does is just drive up the costs, and you have what is known as a death spiral, and makes insurance unaffordable. I'm not going to spend time with this, but this is a chart that was provided by the Office of Policy and Management, and basically shows what would happen, the difference between the kind of premium or kind of financial assistance that's provided through Access Health CT now, what would be provided under the federal law, the congressional proposal AHCA, and the difference, and that's where you get the 2155, that average increase in costs for people who purchase coverage on the exchange. And again, this again is just our state's projection of how much money we could lose just over the next couple of years, and you can see there's this wide swing between almost $90 million dollars and $539 million. Governor Malloy has also said we could lose ultimately up to $1 billion in federal funding. And now, looking at Connecticut's budget. So, just to repeat what I said a few minutes ago, I think most of you may know that the Connecticut state budget is out of balance by over $3 billion for the next 2 fiscal years, one that starts next July and then the following July. The governor, these are just a couple of highlights of the stress that the state budget is under, and therefore what the governor has proposed in regard to Husky and some other health services. As many of you know, he's proposed to reduce Husky A or Medicaid eligibility again for parents down to 138%, of the federal poverty level to cap the amount of money going to pay for dental coverage for adults in the Medicaid program, reduces funding for school-based health centers, a really important resource for health care and health coverage for our lower income children in particular, and reduces funding for mental health and addiction services at the time when we are in an opioid crisis. I do want to say a couple things, if you just go back for a minute, that to the governor's credit, there is a provision that says that if Congress makes good on defunding Planned Parenthood, then somehow, some way, the state would find money to fill that particular gap. There's a recognition that they provide an invaluable service. And then the other thing I want to say about the budget is that, so the governor has his proposal, and now the legislature's in session figuring out how much of what the governor's proposing they want to agree with or disagree with. And the Human Services Committee of the General Assembly issued their recommendations and basically put back the money for those low-income Husky parents, put back money for some of the other cuts that the governor has made, which on the one hand, you know, is a positive sign. There's a recognition in the legislature that you don't want to cut off more and low-income parents from Medicaid. The problem is they still have to find the money to make that happen. And Connecticut Voices for Children for many years now has analyzed the budgets of both the governor and then the legislature and looked at what portion of the state budget goes to what we consider programs that benefit children and their families, including the portion of Medicaid that goes to Husky A and Husky B specifically. And what you can see is from 2008 to 2019, the trend is not going in a good direction, and it's saying that because of the pressures of the economy, that we've switched from having people earn more money to lower paid jobs, because of the pressures to fund costs for pensions and health care for state employees, promises that were made decades ago. The amount of the budget that's going to children's programs is decreasing. And this shows you, you know, what's happening. The reason that it looks like there's more money for Health and Human Services is really an accounting issue, because they had taken out a certain portion of money that goes toward funding hospitals, and then they put it back in. So that's one of the reasons. Don't get too excited that there's really more money there. And then this shows the other side of the budget, who's actually paying to support the state budget. And what we're showing here is that lower and middle class taxpayers are actually shouldering a pretty big proportion of the budget in the governor's proposal. And for instance, it takes money away from lower income working families because it reduces the earned income tax credit. It takes money out of the hands of lower and middle income families by eliminating what's called the property tax credit. And that's it. Any questions or comments? That's who we are. That's where you can find Connecticut Voices for Children. Yeah.
I'm Mary Boudreau with the Connecticut Oral Health Initiative, and I just want to make a comment having to do with the adult dental cap. Is that we've been trying to negotiate with the legislators on bringing it up to $1,500, because that actually helps